Welcome to our panel discussion, Innovation in the Time of COVID. I'm Lisa Roberts, President of the Westchester Jewish Council. The Westchester Jewish Council is proud to serve as the central communicating, coordinating, convening, and connecting organization for Westchester Jewry. We are proud of our 44 years of service to the community, working closely with our 137 member organizations, including synagogues and agencies, which in turn serve the Jewish community of Westchester of nearly 150,000 Jews. We provide invaluable resources to our member organizations, to the larger Jewish community and beyond, uniquely modeling cooperation and collaboration. Our mission is simple. The Westchester Jewish Council serves to connect Jews to Jews, Jews to Israel, Jews to our elected officials, and Jews to the broader community. I would like to give a shout out to Council staff member Helene Schonbrunn, who coordinates all of the Council's Israel work, and Nadav Shachmon, our Westchester County Shaliach. We are so excited to partner with American Friends of Magen David Adom to bring you this exclusive panel discussion today. For those of you not familiar with Magen David Adom, it is Israel's national emergency medical organization, serving as the country's ambulance service, its blood services organization, and its representative to the International Red Cross. And like other Red Cross organizations, it is not a government agency, so it depends on charitable donations from people like you and me for funding. Magen David Adom is renowned as the world's leader in mass casualty response, a skill it honed responding to the thousands of terror attacks that have been inflicted on the Israeli people in recent decades. And it is a leader in EMS technology, which we'll hear from our esteemed panelists in a few moments, how their work and technological innovations are saving lives in Israel and around the world. And it is now my pleasure to introduce our moderator for today, Michelle Devon. Michelle is probably a familiar face to many of you. She is an Israeli-American journalist and TV host living in New York City and is a news anchor and reporter for News 12 and I-24 News. Take it away, Michelle.
Thank you, Lisa, for that very warm introduction. Hello to everyone. It's such a pleasure to be here today with Israel's leading life-saving organization, Magen David Adom. Let's dive right into it and get to know and meet our panelists who save lives every day. Dr. Shafir Botner is the director of Magen David Adom's paramedic school, a veteran MADA paramedic for nearly 20 years, and one of only a handful of first responders serving in MADA's helicopter service. Sounds exciting. Ido Rosenblatt, he's the Chief Information Officer of Magen David Adom, who was recently named CIO of the Year by Israeli tech magazine and website Anashim V'Machshavim, which translates to people and computers. Professor Eilat Shinar has been the director of MADA's National Blood Services in Israel since 1997. She's the author of 108 scientific papers. She teaches transfusion medicine in universities in Israel and is the chairperson of the advisory committee for the Israeli Ministry of Health on blood usage in emergencies. And we'll of course dive into that. And finally, we have Yuval Eran. He is a second generation paramedic from Magen David Adom. He's also an engineering student and also a robotics mentor. We'll be hearing about some of the inventions that MADA and Yuval helped spearhead during this very, very crazy time that we have all been a part of. So thank you again for being with us today. We're going to try to keep it very conversational. I'll also add that we will open it up to questions at the end. So please feel free to submit questions. And if it's for someone specific, do add a name and we will try to get to those questions at the end. So I will be looking for those questions. Maybe some of them we will answer throughout, but please do feel free to submit them as we go. My first question is directed to Shafir. Shafir, I know that you've been in charge in coordinating a lot of MADA's efforts, coordinating with the Ministry of Health and the Ministry of Defense, the Mossad, the Shin Bet, who have all been involved in this effort, that MADA has really been seen as the leader, was really given that mandate. Can you, first of all, tell us about the last 3 months? We know there's currently a surge in cases and what MADA has done to deal with COVID-19.
Well, good afternoon, everyone. Yeah, as you said, Michelle, MADA played a major role in Israel in the coronavirus. And the first, at the beginning, the first action that we had to take is, first of all, to be the answer for all the people in Israel. You have to know that in Israel, the number of Magen David Adom 101 is the national number of calling ambulance or medical services, not like the rest of the world. There's only one national EMS system, which is Magen David Adom. And people called 101 because for them, that's an emergency case, the corona, if I'm positive for that. And people had to call. And of course, the dispatch center that used to get an amount of calls each day had to take a mass amount of calls, which is massively larger than every regular day. And I live to give you this information by my colleague Ido. Later on, we had to do all the swab tests for the people of Israel. The concept was that we don't want to send all the people that need to be swabbed to go to the clinics or go to the hospital. We wanted to keep all the people stay at home because of course, the rationale behind that was that if you are positive, we don't want you to go to the hospital and in spreading the virus more than that. So we have to give this service to all the people of Israel. So for today, since the beginning, we are almost kissing 500,000 swab tests in Israel. And we had to do that, of course, in addition to all the regular paths that we're taking every day, which means taking care of patients, doing the regular job of the paramedics, medics, blood services, and of course, my colleague, Professor Shinal, will talk about it later on. So we had the dispatch center and we have the swab test, and we needed to take care of people that might be positive to coronavirus, transported them from home or from hospital to the hospital, or from a hospital to special places that the government built for the people that are positive to coronavirus. And we had to do that with ambulances or special vehicles, and still keeping our ability to treat the regular patient without infecting them. So we had to do all that with the same amount of paramedics and EMT, and that was a huge effort for us. So that was our three major challenges that we had to deal with at the beginning of the corona. And after a small time, we had to develop special equipment or special application and special computer software that will help us how to deal with the massive amount of people that calling us want our service, and to give the best service that we know to all the people of Israel. So we developed special ambulances that were designed to take the corona people, the positive coronavirus. We made ambulances with a separation between the cabin, the driver cabin, and the back of the ambulance, that the driver can drive safely without being infected, or to wear the protective gear while driving. We have to, Ido will speak about it, we have to develop a special application, special software that will take care of all the sample or swab procedure from the beginning of the citizen that is calling 101 until he gets the answer. This is a long chain that have to be processed in Magen David Adom, and all that development were in no time, under pressure. And you mentioned at the beginning that Magen David Adom is known of taking at the world as a leader organization, taking care of a lot of terror attacks or wars or missile attacks. And that was for us kind of a war that we are not seeing the enemy, we're not seeing the missiles, we're not hearing the sirens. And the people of Magen David Adom became the soldier of the people of Israel, protecting them. We were actually the front line of the people in Israel.
COVID-19.
COVID-19, yeah, we look to the virus in the eyes, just like
Although you
that.
couldn't see it. Now, I will share with the audience that I spoke to you yesterday, Shafir, and you mentioned that a new course of paramedics is underway because there's a lot of work that you've had to do with the same amount of staff. And it's very exciting that there's much more demand for the course now. So this is great that there's a new generation of youngsters who will become paramedics in Israel. You touched upon a lot of very important issues, one of them being the blood bank. So I'd like to refer our next question to Professor Shinar. Professor, one of the most, I'd say, exciting innovations coming out of Israel is the use of plasma to treat COVID-19 patients who are still battling the virus. Can you tell us a little bit about that and how effective is the use of plasma for existing patients?
Sure. Good evening, everybody. It's really very exciting because we are actually doing something that is very old, but we are putting it into work and now against the COVID-19. The idea is that if somebody is sick, their immune system develop proteins that are called antibodies, and the antibodies are actually floating there in the plasma. The idea is to take the plasma, which is the liquid of the blood, out of these people and give it as a treatment to patients who are still fighting the virus and their immune system did not yet make the antibodies. So it's actually what we call passive immunization, taking antibodies for somebody who did them and recovered and giving it to people who are sick and did not have yet the chance to develop their own antibodies. So we started to do that in April. You have to wait at least a month since the disease until you are absolutely sure, or as sure as you can, that the donors are really healthy. And second, that they do have antibodies in the plasma. So March was the big wave of infection in Israel, as was mentioned before in Purim. And on April 1st, we began to collect plasma from convalescent COVID-19 people. Till now, we collected plasma from over 1,200 donors who come regularly to donate plasma. We have antibodies. We test it using a serological test, so we know which unit have antibodies. And I can say that 85 to 90% of the donors who come to donate plasma really have antibodies in the plasma, which is really interesting because that means that about 10% in Israel, 10 to 15% in Israel, of people who recovered from COVID-19 do not have antibodies, which is an interesting thing to know. And then so far in Israel, over 130 patients got transfusion of plasma. In Israel, we give 2 units. In the States, some centers give 1 unit and some centers give 2 units of plasma. And the recovery rate, or I would say people who really the situation improved, runs around 50%. So around 50% of the people who got plasma as additional treatment to everything else that they got really improved. And that's a very encouraging number because we actually rely, as I said, on the immune system of the donors to help the patient recover. So this is where we are today. I just need to mention that there's another use to the plasma, and this is to make a concentrate of the antibodies, which are called immune globulin. And the immune globulin, we can say that the first patient in the world were treated last week in Israel with immune globulin made out of Magen David Adom plasma. And we're following her situation to see how she does. And this is like another way of treating patient with immune globulin.
And like you said, this is an extremely interesting topic that a lot of people around the world are now seeing how effective it is. You did mention earlier that people with antibodies might see their own antibodies decrease over time. So what does it mean? There is maybe a misconception that for those who have antibodies are immune to the disease, and that might not necessarily be the case.
It's a very good question, and the real answer is we don't know what does it mean. It's the phenomenon that we see, that after a month or 2 months after recovering, the donor who come back again and again, we can see a decline, not in all, but we can see a decline in some of them and the antibody level. But the thing to think is that maybe the antibodies go down, but if they will be exposed to another time to the virus, which it will boost their antibodies again. We don't know yet. The only thing I can say about this virus is it behaves very, very different from what we know on other viruses, and we need to study it. So I think we'll have to see what would happen if people will get maybe reinfected, or I would say re-exposed to the virus. Would the antibody level jump up as we do with tetanus sometimes, that we give a boost and then we see an injection and then we see that the antibody level is going up? I hope this is the case, but we don't know actually.
Thank you, Professor Shinal. And Shafil did mention earlier the call centers, the dispatch centers. You've had to set up many more very quickly. I know that you had testing and swab testing posts all across the country. Ido, can you tell us a little bit about the efforts in widespread testing as well as the dispatch centers? I know you just built a new one for the second wave.
Yes, we built a new one, but before the new one, Michelle, just to understand, before the COVID-19, we get answered average. Sorry? 6,000 emergency call in average every day. When we began to receive emergency calls, that people was very scared and had a lot of questions how they should behave, and if they need to go under quarantine and so on. When we got 30,000, and in the maximum, in the peak day, we had 82,000 emergency calls in one day. 6,000, from 6,000 to 82,000 emergency calls.
82,000 per day.
Per day,
At the peak.
correct.
Okay, let's let that sink in.
Yes, when we preferred to the COVID-19 in February, in the beginning of February, when we sitting with the Ministry of Health, we thought about different options, how to react and how to behave and what instructions to give the population. And we decided not to publish a new emergency number for the COVID-19 because there is a medical issue in those questions, and we very afraid to miss critical patient that call to the non-emergency number, and instead to call 101 to the ambulance services. And then we took ourselves to get a good service in the emergency calls, even that we know that we have the increase in the numbers. We didn't imagine to ourselves that we need to deal with 82,000 per day. And what we do is create a new workstation in the beginning in the meeting rooms near the National Operations Center. And after that, we take a school that was shut down by the Ministry of Health, just behind the corner near the National Operations Center. And we take different classes. We build 10 different workstations in every class. So we had 30 classes with 10 different stations. So in the school, we have another 300 workstations. We build a new dispatch or call center in the Home for Command. They gave us a big place, and in Haifa and in Tel Aviv as well. So during 24 hours, we added more than 650 workstations that connect to the same command and control center in Magen David Adom.
And where are you located right now? Because you did give us a little tour earlier, and you showed us one of the new dispatch centers. So where are you?
I'm in the National Operations Center. I take my smartphone just a second, and we gave you a short tour.
So in the National Operations Center, and also you called it a tent, but really there's a new, very big hall where you had to build yet another dispatch center. Oh, you're muted, Ido. Let's just make sure you're on.
Now you can hear me?
Yes, I think we can hear you now.
And just a
Okay.
second.
He's taking us on
Okay.
his phone. Great. So what can we see? Walk and talk.
Walk and talk. Here, this is a National Operations Center. We go inside in a second. But here outside, it was a parking. And as you can see, this is the tent. In the tent, we build another, or we add, this is the tent. And in the tent, we have another 70 workstations that deal only with the COVID-19 in the second wave. We do, even today, thousands of swab samples. Now, we get into the National Operations Center, and you can see all the operators that deal with the emergencies. Need to remember that all the operators are medics or paramedics. And even that we received thousands of calls, you can see the response time. This is the waiting time in seconds. Waiting time in seconds for the emergency call. And this is the National Operations Center. Guys, say hello. Hello.
No, this is really terrific to see this live and to see, I mean, you called it a tent before, but that's just really another very big hall and the newest one. How many call centers do you have throughout the country?
We have 8 different call centers or dispatch unit in Israel. With the tent now we have the 9. But again, when we have the first wave, we build another call centers out of Magen David Adom stations, including schools that was shut down, including the travel agency that was shut down because of the COVID-19. And they gave us the 4th floor building to build the dispatch. We bring
we
other
can't
computers.
see you again for some reason, so if you can come back to the initial frame, that would be great.
I try to.
Perfect.
Walking to the meeting room.
So while you walk to the meeting room, I'm gonna hop over to Yuval, who's been standing so patiently next to something that looks like, I don't know, a new invention. Some of the biggest challenges that were faced by hospitals worldwide was the fear of having a shortage of ventilators. And I know you were part of a team that found a solution for that. Can you tell us a little bit about the ventilator that your team produced and what are we seeing? I'm guessing that's it.
Thank you, Michelle, and hi, everyone. So the AmbuVet initiative was really started due to the expected shortage of ventilators worldwide. So roughly around March 17th, the Israeli Ministry of Defense and the Israeli Ministry of Health gave a call out asking for different teams around the country to come with new solutions that will be really easy to apply in Israel in case that there will be a shortage of ventilators. So as the challenge started, the 108th unit of the Israeli Air Force took upon himself to build a team, and they recruited robotics teams from throughout the country, and us at Magen David Adom and a few other huge corporations like Microsoft and the Israeli aerospace industry and many other volunteers, that we all came together in order to design and build a really easy to multiply ventilator. So as we understood the challenge, and the real challenge was to convert these really simple mechanical ambu bags that we usually use mechanically with our hands to ventilate patients and turn them into ventilators. We had to think about our main goals of this challenge. So as we started, the first thing was that we're going to build something for the greater good, which means that immediately as we finished designing this prototype, we released the whole design and code in open source worldwide, and I'll talk about it in a minute. And the second goal was to make it really easy to multiply by using really commonly used parts such as 3D printers, and we add for the motor in this prototype, you use a windshield motor that you have in your cars. And it has to be really cheap because with the pandemic going on, there's really low availability of products. So you have to build something really cheap. And this whole design with our team took us 10 days to build. Right here, actually, I'm at the robotics workshop that I teach robotics teenagers. So we built the whole thing, and once we finished the design, we uploaded it to GitHub. There, immediately after we released the design, we had more than 20,000 people viewing our design and started downloading and trying to reproduce it. As people got aware of our design, we were actually ranked as the best ambu bag based ventilator prototype in the world by an university at Texas that researched ventilator options. So as we go on and we helped and assist the different teams around the world, we came to actually by mistake create a huge community around the AmbuVent, and our original team of AmbuVent designers came and assisted roughly 300 teams worldwide that had tried to build this design, including countries in Africa and Europe and the United States and South America, all over the world. We have seen some really good AmbuVents versions, depending on what's available wherever they're trying to rebuild it. And overall, we count this as a huge success, and we were able to assist a lot of countries. We even know that certain governments at Africa are trying to build a whole produce line to create these AmbuVents in order to provide ventilators for countries in Africa where even not with the COVID crisis, they have a really big shortage of ventilators.
Yuval, are these AmbuVents, these ventilators, being used in Israel? And if so, are they used in hospitals? Where are they being used?
Well, luckily enough, Israel haven't gone into a situation where they needed this solution. So even though that we came with a solution really fast and it provides the basics needs for a ventilator, it's not a real ventilator, we can call it, because designing and creating a ventilator is usually work that takes years. And this was a quick solution for a huge problem that came upon the world. And for those short times and in times of crisis, this is definitely better than nothing at all.
Amazing, and it's great to hear that Israel did not need to use this, and hopefully we keep it that way. Thanks to you, and thanks to people being careful and practicing social distance, hopefully. I think one of the main challenges that I've heard about from medics and paramedics are people who've been sick, not COVID related, who've been scared to go get checked, who've been scared to go to the hospital and pretty much endanger their life because they aren't doing what they would usually do as a patient. Shafir, can you tell us a little bit about, I know there's a new project that you have running throughout the country, and also about that challenge. How do you face the community who you see is declining to go and treat themselves because of the fear to get exposed to COVID-19 and then endangering themselves as such?
Well, that's actually one challenge that's separated into two main challenges. First of all, we saw also the numbers in Europe and the rest of the world, and also in Israel, that the percentage of people that having what we call out of hospital cardiac arrest increases, which means people are not going to hospital or to the clinic, get the right treatment, and actually dying at home. So we have to find kind of a solution for that. And the first solution was to get the defibrillator closer to the public. So the first project that we're launching those days is smart cabins spreading all over the country. I think Ido could also tell about that, which the defibrillator is inside a cabin, and when people that calling 101, Magen David Adom, the dispatch center can locate the nearest defibrillator that located next to the person which needs it, and they can actually give direction to the public or to anyone that can use the defibrillator. Go to this and that place that which is close, the closest to you. Take the defibrillator and go to give the service to the people or the defibrillation.
Are these already being put in use?
Yeah. They're already. Those days we are spreading them around the country. Actually, they were spread around the country before the COVID, but now this is a smart system that connected with the GPS system to the dispatch center. They can see it on the map. They can locate the place that the people are calling 101 and match it to the closest defibrillator and show the time that needs to get the defibrillator to the patient. And we hope, of course, that will improve the survival ratio of people that have been out of hospital cardiac arrest.
Shafir, can you see?
Ido is moving.
Oh, you can see one right now. This is the first one that was located in the National Dispatch Center. That's how it looks. And Ido, perhaps you can explain over there.
This is great. Thank you.
This is a cabinet, and we can show you in a second how it's looking in the system. But we know to track those defibrillators, and we have a backup if it's not opened from the SIM card that we can open it from the dispatch. We have those ability to open it or to give the instruction how to open it. Shafir, you can take it from here.
Okay, so you can, as Ido explained, you can open it manually with getting the code, or the dispatch center can open it for you with the internet, and that's the defibrillator, the huge defibrillator project. The second problem, or the second challenge for us was, as you mentioned, people that don't want to go to the clinics or to the hospital, even though if they don't have something, like a cardiac arrest, they have a fever or cough or back pain or all kind of community disease, how we call them, and they don't want to go to the hospital, of course.
Even people with existing conditions like heart disease are just neglecting their health.
Exactly. Even if they need, just a checkup, doctor checkup, or they need to get antibiotics or painkillers or having blood tests and stuff like that. So we wanted to get all those services to the people at home. So what we did, Ido will explain later at the software part, but on the practical part, we built we bought machines or equipment that can make all the tests and all the exams that you need at home. We have this equipment in each ambulance, and each team that can get into the patient home, open an online video chat with a special doctor, and the doctor can actually, with the telemedicine, can do all kind of exams like blood exams. You can actually hear the lungs, making watching the throat, looking into the ear, having, of course, ECG, all kind of exams that if you would go to the clinic, you can do over there. And we're bringing the service into the patient home. We're doing all the exams at home. The doctor, of course, see all the results and can give you the medication at home or the prescription to go and buy later on the medication. Even that, you don't have to go out of your home. You can get it with someone that buy it for you. And you actually don't have to go out from your home to the clinic or to the hospital.
Sure. So this is really enhanced telemedicine, and it's giving people the option to have access to medicine and to examinations while staying at home and being protected. One thing, though, that you can't do through telemedicine is blood donation. And Madda has the biggest blood supply in Israel. Professor Shinal, maybe you can tell us about some of the challenges in getting people to donate blood and to maintain the blood supply that you have throughout COVID-19 when it is still very much necessary.
Absolutely. This became a very major issue since the beginning, the breakout of COVID, because we were foreseeing that either people will be sick and we cannot collect blood, or there'll be the lockdowns where people cannot come and donate blood. And of course, we started to see that in the beginning of the month of March, and where little by little, everything was closed on us. So every place that we used to go and collect blood, like the army, military camps, high schools, yeshivas, universities, working places, with a lockdown, everything was closed. So people stayed home and we lost all our donors. So we thought that we absolutely need to collect blood, not so much for the patient with COVID-19, they usually do not need blood transfusion, but for all the others. Because for a long time, the actual surgeries went on, and deliveries, of course, and less car accidents, but still there were some. And of course, in a country like Israel, we have to be prepared for any kind of an event, like terrorists, like missiles or whatever. So in order to have enough blood inventory, we changed the way we work. And we went to blood collection in the neighborhoods. We call it the Sarajevo project, or the Sarajevo model. And I learned it from the man who was the head of the blood bank in Sarajevo during the war, because I asked him, how did you manage to collect blood when it was so dangerous to walk in the street? What did you do? So he said, we took a blood mobile and we went from one home to another, one house to another, and collected blood. So we did a little bit similar. We didn't go from home to home, but we did go from neighborhood to neighborhood, where we have the high rises. So we called people in. We found somebody who was responsible in the neighborhood. And we called people in either to go down and donate in our blood mobiles. We have 3 blood mobiles and 4 beds that people can go in and donate blood. Or we found a hole in one of the high rises that people really joined down and donated. And the other thing, which was very, very important, I think, and well received in the government, was that we succeeded in putting blood donation into the things that you're allowed to do even during lockdown. So it was to go to your physician, if, as Shafir said, some of them didn't, but you can go to your doctor, you can go to a grocery store for some things, and you can donate blood. So if people would show the invitation that we send them to come and donate blood, and they would be allowed to pass in some of the checkpoints. With that, we really increase very nicely the blood inventory, because people wanted to do things. They wanted to help, and this is how they could help. So again, we saw that the population in Israel is very, feels very strongly what we call arvut hadadit, to help each other, to come and really do things as much as you can. I can tell you that now we are in a second wave, and the second wave is tricky for us, because again, some schools are closed, some of them are open, some working places are closed, some of them are half open. It's becoming very tricky. So this week we approached the army and we asked them to allow us to increase the collection in the military. And we hope that we'll be, have enough inventory and then see what happens with the civilians population, because we are waiting to hear the instruction and regulation of the Ministry of Health to see how we can proceed. So yes, blood donation in this time is very, very interesting and very, I would say, challenging.
And it's crucial. So would you say that the blood bank now, is it back to where it was before COVID, or is it still really trying to reach out and get more people to donate blood? Where are you right now?
No, right now, the nice increase with the inventory was in March, and blood, the red stuff, the red blood cells only only good for 35 or even 42 days. So we passed that, and now we have to collect again to have enough blood for everything. So we are now really talking to the people and trying to go back to the other success and have more people coming to donate blood. Yeah, we'll have, I think, a good summer because most July and August is a nightmare for blood banks in Israel because everybody goes on vacation abroad. This year, I think it will be a little bit different. So we'll have to see where people go on vacation and follow them to the hotels maybe or to places where they are to pursue them to donate blood.
Well, they're probably stuck in Israel, so hopefully that works to the blood's advantage.
Right.
We're going to open it up now to questions. I see that some people have already submitted a few questions. And yeah, wow, it's been fascinating. So we will try to squeeze in as many as possible. A lot of people I see are really, really interested about plasma, wanting to know if the donor plasma that is given to people, this is from, Deborah Mayton, is the donor plasma given to people, does it have to be the same blood type as the recipient, Professor Shina?
Yeah, absolutely. There should be a match between the donor blood type and the patient blood type because we were talking about the antibodies to COVID, but of course we have antibodies to the blood type. So absolutely it has to be matched, patient and donor, same blood type. Yes, good question.
Very good question. I didn't know that. The next question, well, Hanina.
Both of them, I take both of them, Michelle.
The next question we see, how does Madeh deal with all the different languages people speak? I think there's a pretty easy answer for that, either Idor or Shafir.
We have people that speaking Arabic, Russian, English, and Amharic as well in the same, in all the shifts. The operators, part of the skills that the screens that you see in the National Operations Center show us which of the operators speak which languages. In this current shift, we have French, we have Spanish, we have Ethiopian, Arabian, English, Russian, if I forget. So, and Yiddish. We have a group of boys or Haredim, ultra-Orthodox guys trained by Magen David Adom and work in separate place in the dispatch, so they speak great Yiddish if we need so. And for another question that someone asked Michelle about the masks that we wear or don't wear in during the shift. So when we move between the different places in the building, we use masks, but you need to understand all the different operators that you saw in the short tour are working capsules, they work in different capsules, so it's the same persons that work 12 hours every day with the same people. If you saw all the workstations are pretty large, more than 2.5 meters between the operators, and they sit before the computer and not one to other. So yes, we're wearing a mask, but not in the capsules during the work in the dispatch.
Great, and the mask questions was from Heina, and the question before was from Albert Kleeman. Yes, Shafir.
Michal, just to add to Ido about the languages, perhaps Ido missed one fascinating fact about Madeh application for the public, that you can chat with the dispatch center. And the interesting thing is that you can chat in your own language, and the person at the dispatch center will see it in Hebrew, and he will answer in Hebrew, and you will see it in your own language, and you can write in each each language that you want. So if you add the free, of course, MADA application, you can chat with the dispatch center with all kind of languages that known to Google.
So
Yeah.
pretty much it could be any language. And I remember seeing videos of so many different languages. So that's definitely not a barrier or an obstacle in MADA's case. Okay, we have many questions. We're going to try to get through a few more, although we're kind of out of time, but well, let's do this quickly and very short answers. So from Vicky Belmont, how are the opening of bars and restaurants affecting the transmission of COVID? I also saw someone asking if Israel opened up too soon, in your opinion. Open to whoever wants to answer.
Who would you want to answer? Well, that's of course governmental decision, and Magen David Adom is not part of taking the decision. Of course, he can cancel it to the people that are taking the decision, but we're in good condition, and as long as we will keep all the instruction from the Ministry of Health, that's supposed to work as we see in the rest part of the world. And as Professor Shinal said, we don't know much about COVID. We have to be a little bit modest about thinking of knowing everything about it's a new disease to the world, and that will be not too smart to say that we know everything about this disease. The virus did not read the medical book, and he don't know how to behave. So we have to be a little modest and treat it with honor.
And you're still learning, as are all the medical.
Like the rest of the world. Like the rest of the world. We're all learning.
Okay, there are
I want to add to that, Michal, that I think that the most important thing is really to keep the protection. So to keep mask the whole time, at work, of course, to wear gloves and to keep the distance. Because if you do that, then the exposure is less dangerous. The other thing that we have to remember is Israel is actually a young country. So a lot of the people that get infected are not really sick. So we not only follow the numbers of people who are test positive, but we have to look really about the people who are hospitalized and ventilated, and of course the death. So if we look at those, you can see that we can manage. So yes, I think they should open bars and restaurants and maybe events, but should limit it, but absolutely keep the masks on and the distance and the hygiene. I think these are very, very important, and so we can lower the exposures. Yeah.
Thank you. And if you can also ask that they cancel the 2-week quarantine, I will visit much sooner. So, if you can put in a good word for me.
Right.
We'll take one last question because we really are out of time. We have 3 from Stephen, so we'll take one of the questions from Stephen Rosenbaum. All right, we can combine question 1 and 2. Question number 1, very short. 1% of the population calling for EMS daily is huge, and it is. What were the numbers prior to COVID, say 1 year ago? I do think you mentioned that when you started speaking, but you can mention that again. And then question number 2, why do you feel this is a second wave and not necessarily the continuation of the first wave? And this will be our last question.
Okay, so Dr. Rosenbaum, before the COVID-19, we get answered to 6,000 emergency call every day in average. In 2019, we get answered to 2.1 million emergency calls annually. Just in March and April, we get answered for 2.2 million emergency calls during those 2 months. So again, 6,000 before the COVID-19 every day. In the March, April, and May, it was 30 to 50,000 every day. And today we held something around 12 to 15,000 emergency calls every day, because they even choose the Kupot Cholim, the insurance companies, in charge to get the first answers that non-emergency that relevant to the COVID-19. I don't think that Magen David Adom can answer about the question for the if or when Israel get or became get entered to the second wave. I don't know. We do know that until 3 weeks ago, we had 20 new patients every day. And in the last weekend, we passed the 600 new patients. So the Ministry of Health say today there is no gatherings at more than 50 people in the same place, and they begin to close part of the, or to give instructions to be more careful and not gathering together a lot of people. There is still public transportation. They didn't shut down all the public places, but I hope that we don't get to this point.
All right, thank you. Would anyone, Professor Shinal, you'd like to add something?
Yeah, I think that calling it the tail of the first wave or the second wave, I think it's mostly semantic. What we see is that we had, as Ido said, a decrease in the new cases. And then once the country was open, because it was really closed, it looks like Yom Kippur. Every day looked like Yom Kippur in Israel in the time of April and May.
In New York City too, by the way. New York City looked like Yom Kippur, believe it or not.
Yeah, yeah. And this is, of course, something that you cannot live for a long time, because people, like 1 million people are unemployed in Israel, which is a lot. And so something needs to be done. So I think we have to understand that we'll have to live with this virus. We just have to behave in a way that the contamination would not be very big, or, as I said, that people at risk really have to be careful and protected. So I don't know. It's we actually started to prepare ourselves for the next wave in the winter, but then it happened now. So just protect the people at risk and protect yourself. And I think we can survive with this virus. I hope. I hope we can survive with this virus.
Shafir, final words?
Yeah, the numbers that defines what calls the second wave are the new cases every day, but we have to remember that's not the important numbers. I mean, perhaps we have those numbers because we're checking more, swabbing more people each day, but the more important number is how many very severely sick people we have each day, and that this number is quite stable. So for now, we're good. Of course, we are concerned about if we have more positive person each day, that increases the chance of having more severe people later on. But although, as long as we're keeping the severe people number stable, so I think we're okay. And as Professor Shinal said, we have to learn to deal and to live with the virus along with us, and not keeping ourselves in quarantine for the rest of our lives.
Thank you, thank you. I just want to say that this has been fascinating, really. And I leave this feeling that Israel is in really, really good hands. So thanks to each and every one of you, Professor Shinal, Dr. Shafir, Ido, Yuval, thanks so much. And of course, Lisa and everyone at the Westchester Jewish Council, thank you for partnering with MADA today. And for everyone else joining and submitting your questions, and sorry that we couldn't get to all of them. I know this was really, really interesting. And of course, this has to do with everyone's lives. So as Lisa said in the beginning, Magen David Adom relies on American supporters like yourself for their funding, and we appreciate your ongoing support. Please visit afmda.org and support MADA. Your gift will, of course, ensure the health of Israel and that Israel stays strong. So thank you, everyone, and stay safe. And up until the next time, hope to see you again. Toda raba.
Toda raba, everybody.
Thank you very much.
Bye-bye.
Bye-bye.